Hi, and welcome back. My name is Dr. Jerry O'Neill. I'm an internal medicine specialist, and I've been asked to make this series of Moments of Medicine, or A Few Minutes in Medicine, by the fine folks over at Dallas Live Tonight. Today, we're going to talk about a very important subject, and that is seeking medical care, or I like to call it when to call 911. As everyone knows, in this country, we have abundant medical care, probably the best in the world. There's really any number of ways you can get medical care should you believe that you're ill or possibly have an illness. The first and probably the most common is to make an appointment with a physician. If you're feeling poorly and things don't seem emergent, or that is, there's no emergency, making an appointment with a doctor is probably the best thing you can do. This brings up the idea of going to what's called ambulatory care clinics. There's probably one close to where you live. These are clinics set up to take care of minor illnesses. Colds, fevers, cuts, scrapes, that sort of thing. If you feel like your problem may be more in-depth than that or more serious and can wait, you might want to wait and get an appointment with a physician, period. In that regard, I will say that most adults over 21 should have access to a physician. If you haven't, establish yourself with a local physician, family practitioner, an internal medicine doctor, or a general practitioner. These are people who can at least diagnose you, usually will get you in quicker if you're a known person to them, and make decisions as to where to take or where to seek any further medical care. Now, in the circumstances of when you think you may have something a bit more urgent, you have two questions you have to ask yourself. The first is, how sick am I? Am I just sick? I have fever, I don't feel well, perhaps I've thrown up, have a little diarrhea. If you feel like you can't wait for an appointment and your physician can't offer you one within a day or so, emergency rooms at hospitals are probably your best option. Be prepared to wait. Emergency rooms are busy. It's not unusual to spend 4 to 8 hours and even longer in emergency rooms. You'll also see a physician who will not know you. Emergency rooms are expensive. They have liabilities, they have a lot of costs, and your bill from an emergency room will usually be considerably higher than that from a private physician. On the other hand, if you need care, certainly within the next few hours, visit your local emergency room. There are people there who can take care of you. Which brings me next to the most important subject, and that is, when should I call 911 or call for the paramedics? There's no set rule, and if you really feel as though you're frightened or that you think for some reason you have a horrible injury and you may die or you may suffer loss of extremity, then you should call 911 or have the people around you call 911. Paramedics will arrive, and if necessary, they'll transport you to the nearest emergency department. On the other hand, there are certain things that sometimes don't come on as quickly or as suddenly that you still should call 911 for. The first and most important is chest pain. If you develop chest pain, especially in the center of your chest or even in the center of the back of your chest, if this pain is anything more than very minor, you should call 911. Heart disease is the leading cause of death in the United States, and unfortunately, its presenting symptomatology, that is what you feel and what you experience, is very variable. It takes an expert with a few tests at his disposal to tell if you're having a heart condition. So if you have chest pain, and especially if it's associated with other symptoms such as radiation down your arm or up your neck, nausea or profuse sweating, If this comes on suddenly to you, you should have someone call 911, or you should call 911 and be seen immediately. The same thing applies to acutely becoming short of breath. If you acutely become short of breath, and I don't mean if you just have to breathe hard, I mean when you feel like you can't get your breath, or if you're air hungry, in other words, your breath isn't big enough to satisfy you, you still feel like you need more air. This too can be a symptom of a very serious and even fatal illness, fatal occurrence. You should call 911. The third reason you should call 911 is if someone in your immediate vicinity is choking. If they feel like they can't get air and there's something stuck in their throat. In a later video, we'll talk about something called the Heimlich maneuver. But even so, you should call 911. These can be life-threatening emergencies. The same is true of loss of consciousness, or we call it syncope. If you pass out, if you lose consciousness, even if it's due to a known seizure, an epileptic seizure, you should likely call 911. The next one is if you have uncontrolled bleeding. If you injure yourself, you cut yourself, or someone cuts you, or whatever it is, if you have bleeding you can't control by simple pressure, you call 911. If you can control it with simple pressure, that is, you can stop it, then you probably need to be seen in an emergency room. There are also special kinds of bleeding, and that is throwing up blood, nosebleeds that can't stop, or blood in your bowel movements. These probably are indications that something needs to be done, and if you can't be seen by your doctor within the matter of at most a few hours, you should call 911. Finally, any episode of near drowning or possible drowning, you should call 911. Any sign of a stroke, which includes sudden weakness of your extremities, slurred speech, sudden confusion, or drooping of the face, especially on one side as opposed to the other. These can be signs of an episode of stroke, and you should know that if taken care of in a timely fashion, many of these can be reversed. So calling 911 is an appropriate thing. Now, there are a few things that are variable, and I'm going to leave the decision up to you. These are head or neck injuries. Head injury, especially if you lose consciousness with a head injury, you should probably call 911. On the other hand, if you whack your head on the kitchen cabinet, you probably don't need to call 911. There's a lot in between. I can't tell you when not to do it or when to do it. You'll have to decide that yourself, but head injuries can be serious, especially if they're associated with loss of consciousness. In that case, no question, you call 911. Sometimes if you have a broken bone, if you're in an accident, if you fall off a ladder, you break a bone, if medical care is not available within a relatively short time, and I'm talking about minutes to an hour or so, you should probably call 911. The same thing applies to swallowing problems if they occur acutely, and that is one day you're swallowing fine, the next day I can't hardly swallow at all. That's probably a case where you should call 911. And finally, if you just can't decide, or if you're afraid, or if the people around you are afraid and can't rush you to an emergency room safely, then please call 911. An ounce of prevention is worth a pound of cure. A lot of people who call 911 are taken to hospitals and find out they don't have a horrible condition. Unfortunately, that's hard to predict at home. So if there's any doubt, call 911 or have someone call 911. In any case, I'll see you next time. Goodbye and good health to you. Thank you very much.